Welcome you into CommonWell TV, where we're talking to some of the top health IT industry experts and finding out how their organizations are making a difference when it comes to interoperability. And one of our newest members of our CommonWell Alliance, that is Inovalon, and Eric Sullivan. He is their Senior VP of Innovation and Data Management. And Eric, let's start off with CommonWell and interoperability and how that was initially started to fulfill a critical healthcare IT a need. Where do you find that to be evolving as new challenges begin to emerge?
Yeah, I mean, so with Commonwealth and specifically, we were looking for a partner to greatly increase our access to kind of the broader healthcare ecosystem. And I think that we had great contacts with different folks within Commonwealth, and made it very good opportunity for us to engage with them, decide how we could work together. We bring to the table, 150 different health plans across the United States who are hungry for more information about their patients or members. So it made total sense to work with one of the largest, networks in the U.S. and advance that. So that's what started the conversation probably 2 years ago.
Yeah, and as we talked about, one of our newer members. So, what have you learned to this point about CommonWell with your organization?
I have been around the healthcare technology data block for a few decades now, amazingly to me at least. I find, and my team actually finds, and working with the Commonwealth leadership and actually the work groups within, rather refreshing. So we have been part of many work groups, advisory groups, and engaging with Commonwealth, especially in the areas of kind of payer use cases, health plan use cases, the ability for Commonwealth to bring the partners together for what can be sometimes an issue that can create some consternation for others. But Commonwealth's done a great job of providing leadership there to bring the different stakeholders together, creating work groups specific to advancing some of the payer type use cases, which we know is a big focus of CMS and ONC right now as well. So I've been finding it very refreshing to work with a group of a very diverse set of stakeholders that are providing value, and really facilitating great conversations. So we're making great progress in the last year. We've really kind of, the progress we made with Commonwealth is probably 5 times faster than most of our other partners to date. Maybe just because of the way it all comes together in the work group sessions and with the leadership that's there.
Eric, as you know, interoperability, hey, it's ever changing, right? So where does Commonwealth fit into that? And then as we move forward, how does Commonwealth improve on that and enhance within that scope?
Yeah, so I think Commonwealth's going to be critical, right? So the partnerships and with the EHRs that are members of, so Cerner and Meditech and others. I mean, those are critical parts of the ecosystem that I think through Commonwealth makes total sense that the connections can be made available. When you think about where we're going with CMS and ONC and interoperability rule that came out yesterday, the ability for folks to be able to connect all the dots and break down the silos across will be critical. The partners that are part of Commonwealth, which is why we joined, really, which is the Cerners and Meditechs and others, really put Commonwealth in a great, unique position to close a lot of those gaps and bring kind of the diverse clinical data together and help the physicians and all the different stakeholders, physicians and health plans and others, hospitals, to really close a lot of the gaps in healthcare.
Share with us a little bit about the specialty of Inovalon when it comes to what you guys do on a day-to-day, week-to-week, month to month and beyond sort of basis.
Sure. Yeah. So, and we're, we are, we have a lot of different things we do, but in terms of kind of the core background of the company, providing a lot of quality and other analytics services to health plans and health systems. I think today we provide about 80% of the nation's HEDIS reporting for health plans. So we are by far the largest quality, measurement, reporting, and analytic technology company out there. So we have, a diverse set of payers, health providers, through our Ability team, specialty pharmacists, which is a really important part of the healthcare ecosystem. We have a lot of diverse constituents that we serve almost always in every case around analytics and data, that are hungry for access to more information. Think of the specialty pharmacist, which is an important part of our platform. They need more information to fill that very, you know, expensive medication for very high risk and very vulnerable patient population. So having access to the right data through partners like CommonWell will really help improve both the experience for our specialty pharmacists, our 70,000 providers that we provide kind of revenue cycle platform services for, and our health plans. But we are really a technology, kind of behind the scenes technology and analytics, predictive analytics company for a big part of the ecosystem.
Eric, within that U.S. healthcare system, when it comes to data exchange, what is Inovalon able to do, and what are you guys doing to make sure that that ecosystem is running, well together?
Yeah, I mean, our customers are both providers and payers and specialty pharmacists. So our focus is to not just leverage clinical data exchange for the traditional treatment use cases, the T as part of TPO, but also operations, right? So health plans fall within the operations bucket, and working with partners like CommonWell to advance the support of those use cases will be critical to where the industry is going, where CMS and ONC are going.
Eric Sullivan and Inovalon, one of the newest members to our CommonWell family. And for more information on them, we invite you to log on to commonwellalliance.org. Thanks so much, Eric.
Thank you. Take care.